Are you recording?
Yeah.
Yeah. When I first got involved with the ECTC program and CCAC, I was kind of lost. Involved in drugs, and ever since I got involved with the ECTC program and CCAC, decided to change my life.
We came at a very crucial time for him. I think that being able to give that intensive health coaching with him early on really set him on a bit of a straighter path to be able to accomplish the things that he's wanted to.
People like Dr. Affleck, Dr. Carfagini, and Dr. Skunta, and Mike at the ECTC clinic has been a great help to me, get me back on track in my life. The social worker Mike at the ECTC clinic has been really beneficial to me. He's like a friend I can talk to, you know. I'll talk about all I've been through.
There's certain things that Mike's able to work through with him and talk through and leave with him feeling in a better spot. I think that Mike has also helped him to future think a lot and think about where he would like to go with things and try and work towards new goals with him.
I've had 2 strokes, overdose on substances 14 times. Why did I live through all this, you know? It's mind-blowing how I survived all this. And, you know, if I can give back to the community from what I've taken so much from, I'm trying to understand myself better to see if I can turn something positive about all I've been through and all the tragedy in my life.
He went to see Mike one day and he comes back to me and says, I need a records check. I need to get things figured out because I want to do this. This is what, this is where he sees his ambition going next, is being able to talk about his experiences to at-risk youth and to help the future generation not kind of stumble and fall where he has.
Well, I want to see if I can teach maybe kids at risk what to expect if they continue to lead the life they lead, maybe breaking the law or continue to use substances like alcohol or drugs. I survived all that, so maybe I can possibly mentor them or teach them to what they can expect if they continue to lead the life they live. I'm getting right now I'm getting a neuropsych assessment done to see if I can go back to finish my university education. I had a stroke in my last year of university at LU, so I wasn't able to finish.
And I think that it would be a great idea for him to be able to go back to school and learn. I mean, he's very smart and he's very capable of going back to school and being very successful at it. So I think that that would be an excellent goal for him to reach for. And that's something that when we first started talking, that wasn't even really on the table. That was something he never thought he would be able to do or even reach for. So being on the other side of that is really, really nice to be able to see him start reaching further now. That's been really nice.
She's always there for me to talk to. She came to my appointments, talked to my doctors, and made sure she wrote down what my doctors said. As I have a brain injury, and it's really hard to remember what my doctors say, so she's always writing down stuff for me to do, like blood work or x-rays, and just keep me on track in my health care and my recovery. You know, she's always there to challenge me to do better.
You know, a year later we can look back and see how far he has come and how much he has accomplished.
The health and department has given me the hope to do better in my life, stabilize my health. having a healthier lifestyle and taking care of myself with the guidance from Nicole and the Health Things program, I was able to reverse my diabetes, stabilize my clotting disorder.
When we first started working with him, he did have Hep C, and then I think one of his first appointments I went to with him with his doctor about it said that they couldn't find it, and we were obviously shocked. You don't really hear about that happening all too often. And we just went for his 6 months clear in February, and the doctor can't find it. He said, you've been the ideal patient.
I haven't been, actually the only time I've been to ER was in the last 6 months, was once about 2 months ago. I had a bladder infection, moved up into my kidneys. Something I couldn't stop, it happens to people, so. I was there once a month.
He's able to advocate for himself now after understanding what he needs. And I think that that's important too, is that he's able to voice who he is and, take pride in where he is now and be able to look back and feel accomplished and know that he's on the other side of some very, serious, medical conditions.
Health has given me the skills I need to go on in the future and maintain my health care.
That sense of accomplishment he's leaving with this program, I think, is really important, and being able to start to set those new goals.
And I have the knowledge I need to go on in my life without Health Things. They've given me that knowledge and that skill I needed to take an active role in my health care and my recovery.
If we can just get a few more supports around him, he'll continue to be successful in whatever he does, because he himself has taken ownership of his health care, which was the main goal of HealthLinks.
Thank you, thank Nicole, thank the ECTC program, HealthLinks. It's been a tough road, but worth every minute. With people like Nicole and the HealthLinks program, saved my life. Thank you very much. Thank you for being there for me. I'm grateful. Still full of hope, though, to do even better.